What's up? Time Talks Med here. Let's continue our complete cheat code for heart physiology. We're doing this in 4 segments. The first video was about the different types of cardiac muscle, the action potentials of pacemaker cells and contractile myocardium, and the general properties of our cardiomyocytes. In this video, we will look detailed into the cardiac cycle and draw a curve and understand what happens at each phase. In the third video, we will cover everything you need to know regarding the cardiac output, and in the fourth video, we will cover the regulation of the heartbeat, covering all the most important mechanisms that actually changes the contractility and the heart rate. Alright, awesome. Now, cardiac cycle is basically just the beginning of one heartbeat to the beginning of the next, and it includes all the mechanical events happening within one heartbeat. So if you look here, this is the heart, and here it's pumping continuously, showing you one cardiac cycle after the other. And if you remove the walls as it's pumping, you will see that there are specific events happening. And if you just stare at this heart, focus on one chamber, you will notice that one cardiac cycle consists of 2 periods. One during which the heart muscle relaxes and refills with blood, called diastole, following a period of contraction and pumping of blood, called systole. What we are going to cover now is what happens within each phase, what valves open, when do they close, how long does these phases take, and how pressure differences are controlling all of these events. I have simplified everything, so don't worry. At the end of this video, everything will make perfect sense. Now, we divide the cardiac cycle into 5 phases according to what the heart is doing at that specific moment, saying it simply. The first phase is the beginning. It's the atrial systole. In atrial systole, both atria contract and pushes the blood into the ventricles. This lasts for about 0.1 seconds. The next phase is something called isovolumetric contraction, where the ventricles contract, but there's no blood flow out of the ventricles since both valves are closed. This lasts for 0.04 seconds. Then after that, the ventricles are going to push the blood into the great arteries, into the pulmonary trunk and the aorta, lasting for about 0.26 seconds. So the ventricles contract for about 0.3 seconds if you add up the isovolumetric contraction and the ejection phase. After that, we got isovolumetric relaxation, where all the chambers relax. There's no blood flow into the ventricles, but there's blood passively coming into the atria, lasting about 0.08 seconds. Then lastly, there's the passive filling phase, where the AV valves open, the blood is passively flowing into the ventricles without the atria contracting, lasting for about 0.32 seconds. And then, after that, we go back to the first phase, the atrial contraction, where the atria contracts, squeezing the remaining blood into the ventricles. Now, take the parts where the ventricles are contracting. What do we call them? Ventricular systole. Take the parts where the ventricles are relaxing. What do we call them? Ventricular diastole, or common diastole, or common pause. Now, I will give you a little cheat code in understanding how the valves work during each phase. Here you have a bottle, just an empty bottle with a cap on. The bottle has a specific pressure within compared to the pressure outside. Let's say you grab this bottle and give it a good squeeze. What happens to the pressure within now? It increases. Now, you're super strong. Let's say you squeeze extra hard. What happens now? The pressure inside increases even more. And you squeeze so hard that the cap of the bottle pops open. Doesn't it then make sense to say that the bottle cap popped open because the pressure within the bottle were much higher than the pressure outside of the bottle? Now, let's add the heart. Which way does the valve go? It goes to the ventricles. So we can say that the ventricles are outside of the bottle cap and the atria is underneath the bottle cap. If the pressure in the atria and the ventricles are equal, what will happen? Nothing. If the pressure in the ventricles are higher than the pressure in the atria, what will happen? Nothing. The bottle cap won't pop open because of that. Now, if the pressure in the atria is higher than the pressure in the ventricles, what happens now? The valve is going to pop open. That is basically how the valves in each phase is controlled by the pressure changes. Let's put this to practice. Now, the cardiac cycle is all dependent on the pressure of the atria, ventricles, and the great arteries. So let's go ahead and make a pressure curve. Here in the vertical axis, we got blood pressure expressed in millimeters per mercury, and the time on the horizontal axis in seconds. Let's now divide this curve so that it corresponds to each of these 5 phases. And we will draw the pressure in the left ventricle in red, pressure in the left atrium in blue, and pressure in the aorta in yellow. Now that we have everything set up, let's start with the atrial systole. During the atrial systole, the pressure in the ventricles is lower than the pressure in the atria. Ventricular pressure is lower, and because it's lower, the AV valve is open, and blood is being squeezed into the ventricles. While this is happening, the pressure in the ventricles are lower than the pressure in the great arteries, right? That means that the semilunar valves are closed. Remember, the pressure inside is lower than the pressure outside. So, how does it look like? Imagine now that during atrial systole, while atrium is contracting, there is no blood from the veins coming into the atria. But since it's contracting and pushing the blood through the AV valves, the pressure is going to rise initially before decreasing again, since it's getting more and more empty. When it comes to the left ventricle, blood from the atria is flowing into the ventricles, so pressure is going to rise. How much? In the right ventricle, about 4 to 6 millimeters per mercury, and in the left ventricle, about 5 to 10 millimeters of mercury. As we're approaching the end of the atrial systole, you will notice that the pressure in the left ventricle goes a little bit down, partially because once the atrium is empty, the plane of the AV valve rises a little bit upwards. And also, while all of this is happening, the pressure in the aorta keeps decreasing as well, since blood is leaving the aorta towards the periphery, so the plane of the semilunar valves may rise a little bit as well. Right after the atria is done contracting, we enter the isovolumetric phase. In the isovolumetric phase, the ventricular pressure is higher than the aortic pressure, so the AV valves are closed, and the ventricular pressure is lower than in the great arteries, so the semilunar valves are closed as well. In this phase, the ventricles are squeezing without any blood moving. Now, how does this phase affect the pressure? First off, the pressure in the atria is going to rise, and there are 2 reasons for that. The first one is that when the AV valve shuts close, it pushes the AV plane a little bit up, increasing the intra-atrial pressure a little bit. The second reason is simply because the ventricles are contracting. They're contracting, which also pushes the AV plane a little bit upwards. The pressure in the aorta is just going to keep decreasing still, because blood is still flowing out to the periphery. Now, what happens with the pressure in the ventricles? It shoots up. The walls are contracting, but there's no volume change. Blood isn't going anywhere, so the pressure is going to rise a lot. So notice the red line is above the blue line, which means the pressure in the left ventricle is higher than in the atria, so the AV valves are closed, while the left ventricle pressure is still lower than in the aorta, so the semilunar valves are still closed. Now we enter the ejection phase. In the ejection phase, the pressure in the ventricles are higher still than in the atria, so the AV valves are closed. The pressure in the ventricles are higher than that of the great vessels, so the semilunar valves are open, and blood is being pushed out into the great vessels, in both the pulmonary circulation and in the systemic circulation. Now, how does that affect the pressure in each part? The atrial pressure during the ejection phase is first going to decrease, primarily because while the ventricles are contracting, it's going to pull the AV plane downwards. I can't express how important this is for the venous return. Because look here, while the ventricles are contracting and pulling the AV plane down, it decreases the pressure in the atria, which facilitates the venous return into the atria. Same way as if you're holding a syringe and want to suck up some fluid, how do you do that? You pull this part back, decreasing the pressure in the chamber of the syringe, which allows for the fluid to move in. That same mechanism is happening here in the atria. While the ventricles are contracting, it pulls the AV plane down, decreasing the pressure in the atria and increasing the venous return. Eventually, the pressure will rise a little bit again, since the atrium is getting filled with blood. Now, the pressure in the ventricles are higher than that of the great arteries. So the pressure in the great arteries are about 60 to 80 millimeters of mercury in the aorta, and about 10 to 15 millimeters of mercury in the pulmonary trunk. So the pressure in the left ventricle is higher than in the aorta, and the pressure in the right ventricle is higher than in the pulmonary trunk. Because of that, the semilunar valves are open and blood is ejecting into the great arteries. Now, the left ventricle, as it contracts, is going to reach a maximum pressure of about 125 to 130 millimeters of mercury in the left ventricle, and about 25 to 30 millimeters of mercury in the right ventricle, though we're mostly interested in the left ventricle for now. But as the left ventricle is having less and less blood within it, as it's pushing it out, the pressure starts to decrease. The pressure in the aorta is going to more or less follow the left ventricle. So what happens is, right in the beginning, just as the aorta is receiving a lot of blood, it's going to initially get stretched as blood is filling up here. Remember, the aortic wall is quite stretchy, so it can accumulate a certain amount of blood. While, of course, some of that blood is going to leave, but not all of it. That's why the pressure in the aorta rises together with the left ventricle initially. And at the end of the ejection phase, the pressure starts to decrease as the blood doesn't rush into the aorta as quickly as it did in the beginning anymore, since the ventricles don't have that much blood within it after pushing everything. So there's still going to be some inflow at the end of the ejection phase, but not as fast as in the beginning. This happens while blood is flowing into the periphery. So the blood inflow is lower than the blood outflow, so the pressure decreases. Now we're done with the ejection phase, and we enter the isovolumetric relaxation. We have done our job, it's time to relax. All the walls are relaxing, we've entered the common diastolic phase. So now the pressure in the ventricles are higher than the pressure in the atria. So the AV valves are closed, and the pressure in the ventricles are now lower than the pressure of that in the great arteries. So the semilunar valves are also closed. What's happening now is that the atria is still passively getting filled with blood while the walls are relaxing, so the pressure increases a little bit. The ventricles are just tired at this point. It steeps all the way down. It doesn't contain a lot of blood within it, and the walls are relaxing. The pressure in the aorta, however, is a little bit interesting now. The pressure is going to increase a little bit at first, because when the pressure within the aorta becomes higher than that of the ventricles, the semilunar valves are gonna close. And what happens now is that there's gonna be a brief moment where the blood flows back and fills the pockets of the semilunar valves with blood before it's reflected back again. That's why it initially rises just a little bit before it starts to decrease again as the blood continues to flow out towards the periphery. Now we've come to the last phase, the passive filling phase, where the pressure in the atria is now higher than the pressure in the ventricles, so the AV valves are open. The pressure in the ventricles are lower than the pressure in the great arteries, so the semilunar valves are closed. What's happening now is that blood from the atria pours into the ventricles, so the pressure decreases a little bit in the beginning, and then it remains more or less stable. The ventricles are going to receive all the blood passively. Just because of that pressure difference, you will see that the red line is continuously below the blue line, which means the pressure in the atria is continuously higher than the ventricles. So the AV valves are open and blood is filling without any parts of the heart contracting. While this is happening, the aortic pressure is just going to continue to decrease because there's going to be a constant outflow of blood from the aorta and out to the periphery. And then we are back at square one again in the cardiac cycle, back to the atrial systole, where the atria is going to contract and increase the pressure. It's important to highlight here that during the passive filling, that's when the majority of blood is going to fill the ventricles. About 80% of the blood flows in during the passive filling phase, while during the atrial systole, we call this phase active filling. Means it's going to actively squeeze hard, trying to push the remaining 20% of blood into the ventricles. So that's really it. That's what happens within one cardiac cycle from the beginning to end, showing the left ventricle, left atria, and the aorta in this graph. That's what we're interested in general. And here in the bottom, you will see when the semilunar valves are open and closed, and when the AV valves are open and closed. You will notice every time the blue line is above the red line, the AV valves is open. and whenever it's below, the AV valves is closed. Same with the semilunar valves. When the red line is above the yellow line, the valves are open, but when the red line is below the yellow line, the semilunar valves are closed. Awesome. Let's now expand this diagram a little bit more. Now, if you get a patient and you take a stethoscope and you put the tip of the stethoscope on the patient's chest, you can hear some heart sounds, right? What parts of the cardiac cycle do you think you're hearing? Well, let's record the sounds of the heart and make a curve called Phonocardiogram. When you look at this diagram, you will see that we're able to record 4 heart sounds, but in reality, we're really only able to hear 2 heart sounds only, the first and the second, because those are the loudest. The third and the fourth heart sound can only be recorded only with a phonocardiogram, with the proper amplification of the sound. Now, the first heart sound can be heard at the beginning of the ventricular systole, and that's why we can also call it the systolic heart sound. And there are actually 3 reasons for the systolic heart sound. The first reason for the strong systolic sound is because of the sound produced during closure of the AV valves at the time of when the pressure in the ventricles are greater than that of the atria. The second reason for this sound is because of the vibrations of the blood as it hits the ventricular wall during the isovolumetric contraction. And the third reason for this strong sound is due to the opening of the semilunar valves and blood rushing into the great arteries. The second heart sound is heard at the beginning of the diastolic phase, and it's also called the diastolic heart sound. And the diastolic heart sound is due to the closure of the semilunar valves when the pressure of the aorta becomes greater than that of the ventricles. The third heart sound is recorded at the beginning of the filling phase, after the AV valves open when the blood from the atria fills the ventricles. While the fourth heart sound is recorded during atrial systole, or active filling phase, when strong atrial contraction pushes the blood into the ventricles. Kind of makes sense, doesn't it? So again, the first and the second heart sounds are the ones we can hear. Now let's say you listen to the heart sounds of the patient. How do you differentiate these 2 sounds? Well, there are 3 ways to differentiate them. The first heart sound is louder than the second one, and the first one has a lower frequency than the second one. But the main difference, the main way to differentiate these 2 is by listening to the time at which they appear. Because look, the distance between the first and the second heart sound is shorter than the distance between the second and the first heart sounds. Makes sense, right? Knowing this will make it so much more easier to diagnose things like valvular stenosis or regurgitation. The third and the fourth heart sound is actually pretty hard to record unless the patient has a really high blood flow and turbulence. So that's the heart sounds. First heart sound represents the systolic sound, and the second heart sound representing the diastolic sound. The last thing I want to mention now is something called ventricular volume. How do we classify the different volumes at different times during the cardiac cycle? Now, after the passive filling phase and the active filling phase, right after the AV valve is closed and the diastolic phase has ended, we have a certain amount of blood within the ventricles, right? So we say the maximum amount of blood that can accumulate within the ventricles at the end of the diastole is right around 110 to 150 milliliters of blood. We call this value the end diastolic volume, and we can now divide the end diastolic volume into 3 parts. I will just show you quickly here before showing it on the graph. Alright, so the end diastolic volume, which again is the maximum amount of blood within the ventricles, can be divided into 3 volumes. Now, during the systolic phase, blood is being pushed out towards the aorta. That volume of blood that's being pushed out during one cycle is called the stroke volume, which is about 60 to 100 milliliters. In addition to that, there's also something called reserve volume, which makes up around 20 to 40 milliliters. It's called reserve volume, meaning if the ventricles were to give up a stronger contraction, a really strong contraction, you would eject the reserve volume as well. So it's kind of an emergency if your body really needs a lot of blood. The third volume is called residual volume, which is the volume that's never ejected from each ventricle even during the strongest contraction. So the ventricles never really become completely empty, mostly to prevent the walls from sticking to each other. Remember, anatomically, the right ventricle has a weaker contractility and a larger internal volume than the left ventricle. So the residual volume in the right ventricle might be a little bit higher than the residual volume within the left ventricle. So reserve volume only pushed out when needed, residual volume never pushed out. The last two volumes, the reserve volume and the residual volume, can be combined, called end systolic volume. So we got end diastolic volume, and after the systolic phase, when the heart has given off the systolic volume, we're left with end systolic volume, which contain reserve volume and residual volume. If you now take the end diastolic volume, you can make up a percentage of how much of that volume has actually been ejected out of the ventricles. We call that ejection fraction. So normally the amount of blood ejected should be about 50 to 70% from the total end diastolic volume. Now, imagine a patient with heart failure. If the heart has cardiac muscle failure, the contractility decrease. And if the contractility decrease, what happens with the ejection fraction? It decreases as well, becoming even lower than 50%. So despite the fact that the ventricles are getting filled with blood, they can't even eject the normal stroke volume anymore. We will talk more about this in detail when we go through the topic of heart failure. But now, let's go back to our graph. We got our end diastolic volume, right? When the pressure of the ventricles rises above the pressure of the aorta, the semilunar valves open and blood is being pushed out from the heart. That blood that is pushed out during one cycle is called stroke volume. And now only the end systolic volume is remained within the ventricles, which consists of the residual volume and the reserve volume. And notice now at the end of the isovolumetric relaxation, when the AV valves open, about 80% of the blood is filled passively into the ventricles, and the rest of the 20% is filled actively while the atria is contracting. Alright, so that was everything I had for the cardiac cycle. We covered all the 5 phases of the cardiac cycle. Tell me, what is the name of the 5 cycles again? Atrial systole, isovolumetric contraction, ejection, isovolumetric relaxation, and passive filling phase. Awesome. What else did we cover? We made a pressure graph for the cardiac cycle showing pressure of the left ventricle, left atria, and the aorta. And we added the Phonocardiogram for the heart sounds and covered the ventricular volumes at each phase of the cardiac cycle. The next video is going to be about the cardiac output. Thank you all for watching. If you found this information helpful and want a little extra practice on cardiac cycle, I've created a quick follow-up video with quizzes and questions. These resources are available exclusively for channel members, and I've kept the channel membership fee as low as possible to support the channel's growth. Your support means so much to me. Consider becoming a channel member to get access to these extra resources and help me continue creating more educational content like this. Just click the join button below to get started. Thank you again for watching, and I hope this was helpful. See you in the next video. Peace.